What are the treatments available? The symptoms of depression or anxiety that occur amongst childbearing women are similar to those that occur at other times of life. However, the choices for treatment may differ during pregnancy or when a woman is breastfeeding. Treatment options include counselling, psychological therapies and medications. It is important to treat depression and anxiety as early as possible because these conditions not only cause distress for the mother but also influence her ability to cope with the infant and their developing relationship. Partners and young children can also become stressed when a parent is anxious or depressed. Types of treatment will vary with the nature and severity of the symptoms and the type of depression experienced. Wherever possible, doctors try to avoid the use of medication that might affect the developing fetus or the breastfeeding infant. However, in certain cases, the severity of symptoms sometimes makes it necessary for medication to be used as part of the treatment. A consultation with your GP or psychiatrist will assist you to get help about management of symptoms. There are psychological or counselling treatments. Stressful life events, relationship difficulties or personality patterns can contribute to the difficulties of coping with a newborn baby. Psychological therapies and counselling are particularly helpful for managing non-melancholic depression. In many cases, the simplest treatments are those that are supportive and educational and which aim to give the woman and her partner some understanding and acceptance of the causes for the depression or anxiety disorder and information about ways of coping. Your doctor will be able to advise where you can access a psychologist or counsellor. What about medication? Always discuss medication issues with your doctor before taking any medication while pregnant or breastfeeding. There are potential risks associated with exposure of the fetus or breastfed infant to medications, so the decision to use medication needs to be carefully weighed in terms of benefits versus risks. If you are taking prescribed medication and plan to become pregnant, discuss your plans with your doctor before discontinuing your medication to ensure that you do not experience adverse withdrawal effects or a relapse of the condition being treated. What about antidepressants? Current research shows that some medications appear to be relatively safe when used in pregnancy, do not appear to cause congenital abnormalities. These are the SSRIs, the selective serotonin reuptake inhibitors, and the tricyclic antidepressants. A recent drug company alert on Aropax, an SSRI, suggests that it may be associated with heart defects and thus should not be taken in pregnancy. Your doctor will know which are the safest medications for use at this time. What about during breastfeeding? In breastfeeding, less than 5% and as little as 1% of the drug passes into the breast milk, which means that exposure of the baby to the drugs is minimal. Some babies show withdrawal effects from SSRIs and may need medical supervision for a short time.